Hi, my name is Cheyenne Brown, and I'm going to be talking about whether college courses are important or not when it comes to your specific career field. Now, to start off with, we're going to talk about math. I hate math. All throughout middle and high school, I would do whatever I could to avoid going to class, even though I still went. And I would say, I'm not going to do this test, I don't need to do this assignment, but I would still do it and I would still pass. I'm not terrible at math, just the wording of the questions never really did anything for me. It did not help me in a way. They're just worded too confusing for me. And I would much prefer if it had nursing elements. For example, a question I found on the internet is a resident needs to take 500 milligrams of metapropyl per day, but there are only 25 milligram tablets on the cart. How does the resident get the medication she needs? That question is very relevant in what I am doing now. I'm a med tech at my facility, so I'm the one giving out the medications, although they do come pre-packaged and pre-labeled, and on my computer it tells me what medication the resident taking and what dosage she requires, or he. Now, if math did this, I would be a lot happier with it, and I wish that you could just go straight into nursing school and it tells me, oh, this is the nursing math you'll use, this is what you won't use, because I don't feel like I need to know about lines and squares and triangles and shapes and areas and all that for a nursing skill. It just seems irrelevant to me, and I don't like to learn it because I'm just not interested and I'm not as engaged as I should be because of it. Now, next topic is anatomy and what it deals with my career. Obviously, anatomy is a foundational skill and course that I need to become a nurse. But I want to be a pediatric nurse, so right now I'm learning about the adult body. I don't need to know about that, in my opinion. I would much prefer to learn about children, infants, and young adults as it pertains to pediatric nursing, because that's what I want to do. I don't need to know about a 70-year-old lady. I need to know about a 7-year-old or a 7-month-old. That's more relevant to me in my career. And on more than one occasion this semester, my professor has told me that this topic we're learning is useful to her class, but maybe not in nursing. Or that something we should be learning in nursing we'll go over then. I would much rather just straight into nursing school and they teach me what I need to know instead of all these other things. Now, that brings me to a last topic, which will be my speech class. I am very happy that I took this course. I'm very happy I took it online because I would probably talk myself out of getting up in front of the class, but I can record and retry and figure out if I like it when I'm doing these. So I can just be me instead of having to put on a show. But with that being said, I love this course and it's teaching me how to public speak as is told in the guidelines. But it really is going to help me in my future career because I'm going to need to talk to families and patients and doctors and nurses and coworkers and physicians and everyone I'm gonna have to speak with when I become a pediatric nurse. So I can't hide away from it. I can't hide behind a corner when a family comes in. I can't tell my coworker, oh, you go deal with them. I can't do that. They're my patients and I need to take care of them, and I need to be the one to update their families on any changes in their status. Right now I am getting a little bit of practice with my residents because when their families come in, I have to speak to them, update them on their loved one's conditions, and when they call on the phone asking for an update, I'm usually the one that is answering their questions and giving them an update on my resident. So that's also been very helpful to me, and that's why I took this job, so that way I can kind of get that first-hand experience before I go to nursing school. With that being said, my final conclusion and my takeaway point with all of this is that I feel like if you know what you want to do, why do I need to do all these other courses that are my prerequisites? Why do I need to do those? I understand English. English doesn't seem very necessary past a certain level to me anyways, but I just can't see how poetry fits in with nursing. I just can't. So I just feel like I wasted a semester of my life that I could have been doing something else. Speech is the only one that I think is relevant, and psychology, because you need to learn about the brain and how it works in order to be a nurse, I feel. And like I said, anatomy has a lot of foundational information that we need, but other than that, I just feel like prerequisites in total are just something to fill up your life so they can say, oh, you are teachable, oh, you'll stick with it before you go into your program. Thank you.